Hi, I'm Dr. Sparks. Colonoscopy is a procedure that I perform at Parkview Wabash Hospital. It's a procedure to examine the inside portion of the colon for both polyps and tumors that can occur in the colon. Polyps are important because that's what eventually turns into colon cancer. So as long as we can find those polyps and take them out before they turn into cancer, then we've prevented that from happening in the future. The procedure at the hospital is performed in the operating room, where I use an anesthesia physician to provide you with sedation. Most people don't remember being in the room or any portion of the procedure. It's essentially a television camera on the end of a tube that we insert through the rectum, and we examine the entire length of the colon, examining the inside wall for polyps. If we find polyps, we remove those, and there is a small risk of bleeding if we do that. If you're on any type of blood thinner such as Coumadin, Eliquis, or Xarelto, please let me know that when I talk to you in the office. The other risks or complications of a colonoscopy include bleeding and infection. As you can see, there are several curves and turns to go around, and it is possible that we can perforate or poke a hole in the colon. If that happens, it does require surgery to have that perforation repaired. We are very careful to avoid this complication, and if we have a problem with one of these corners, such as this one, and it's too sharp or I just can't get the scope to traverse that corner safely, I will stop the procedure, and if I stop the procedure here, I will not see the right side of the colon. And we would order an x-ray test that would be done several days later called a barium enema. That procedure is performed at the hospital in the radiology department. It's not quite as good as colonoscopy at finding polyps, but if it's the safest way to examine that portion of the colon, that's what we will do. It's also the alternative to colonoscopy. It is also possible that we can miss small polyps if they're hiding around a fold or a turn in the colon, or if you have any stool left. Other risks include the risks of anesthesia, and you'll have a chance to meet the anesthesiologist before the procedure occurs. Colonoscopy takes approximately 30 minutes to an hour to complete, and it's performed in the operating room, as that's where we have the equipment. I do use an anesthesiologist that is there to monitor your vital signs and to provide you with IV sedation. After the procedure, you'll be monitored in the recovery room for a few minutes and then transferred back to the outpatient surgery department. There, the nurses will continue to monitor your vital signs and make sure you recover completely before you are discharged home. It will also be necessary for you to arrange a ride home because of the medications you will receive during the procedure. If we remove tissue, polyps, or do biopsies, those results will be available approximately 1 week after the procedure. You can either return to the office for those results, or we can provide that information by telephone. Copies of the reports will also be sent to the referring physician, and we will provide you with a summary of our findings at the time of the procedure. We'll have a chance to meet in person shortly. If you have any questions, I'll be happy to answer any questions you may have. Also, during the process today, you'll learn how to schedule the procedure. Someone will discuss the preparation the day before, as well as your medications. Particular concern is with blood thinners or with diabetic medicine, that we should discuss those before you leave the office today.